A warm welcome to all our participants and our viewers. I'm Dr. Anu Vashish, MDS in Conservative Dentistry and Endodontics, and I'm the Membership Director at Cynodent. With me, I have Priyanka Verma. She's the Executive Head and our co-host tonight. I would like to thank CEO and founder of Cynodent, Dr. Anmol Bagaria, for organizing this amazing session. Cynodent is a unique platform, first time in India, a digital healthcare platform that provides and enhance a good relationship between patient and doctors. It enables real-time appointment scheduling system. Our goal is to create an easy access to healthcare services and communication or scheduling appointments for the dentist and the patients. Cynodent brings together at economic prices and minimum waiting time because everyone has 24 hours and everyone wants to utilize it. Cynodent is here to create a precious and healthy smile on patient face with minimum efforts and maximum welfare. I would want all the participants to mute themselves, please. So now this global pandemic has affected our dental practice, our treatment plan, our management, as well as our decision making and protocols. To solve all our problems and clear our dilemmas, we have with us Dr. Virinder Goyal, our speaker for tonight. Sir is the member faculty of Dental Surgery, Royal College of Physicians and Surgeons, Glasgow, UK, President of South Asian Association of Pediatric Dentistry. He is the professor and head of Department of Pediatric and Preventive Dentistry in Guru Nanak Dev Dental College and Research Institute, Punjab. He is the adjunct faculty of Dr. D.Y. Patil Dental College, Pune. He is the member of Education Committee in International Association of Pediatric Dentistry. He is the ex-professor and head of Department of Pedodontics at Dasmesh Institute of Research and Dental Sciences. He is the ex-professor and head in the Department of Pediatric Dentistry at postgraduate program at Surendra Dental College and Research Institute. He is the fellow of Bangladesh Association of Dentistry International. So we are blessed to have you, sir, and we are excited for the today's session. Over to you, sir.
Thank you so much, Anu, for this wonderful introduction, for making my evening so pleasant. Thank you so much. I must thank Anmol for inviting me for this platform and meeting all of you. It's really amazing. Anmol, first of all, may I request all the attendees to mute? Maybe, Anu, if you have the option of muting all, is it possible? Can you mute all?
Yes, sir. Yes, sir.
Just see if it is possible to mute all.
Hello, ma'am.
Okay. Okay, because since we are live and it doesn't look nice if there is a lot of disturbance, so I request all of you to please keep your microphones mute, and I'll try to finish my presentation within 45 minutes, and then I will take all the questions whichever you have. And I have already started using Facebook on my iPhone also, so that simultaneously, if some questions are there, I'll answer. Maybe you can post your question into the chat box also, because I think the this Zoom has a limited option for attendees, like 100 or something can be added. So all rest of you can join through Facebook. I think Dr. Anmol has already shared the link with all of you on your WhatsApp groups, whatever the groups I have seen. Because I saw today that the new group which was formed is 14. So I can imagine how many number of attendees you must be having in your previous webinars. It's amazing, Anmol. And I was going through your details on Facebook. What are your achievements? It was very heartening to see, like, what all you have achieved in your life at such a young age. It's very difficult to achieve such things at such young age. I must congratulate your parents for wonderful achievements. God bless you, dear. So now let's
Thank
talk
you so much, sir.
about something about the COVID-19. Uh, all dentists, all students, UGs, postgraduates who have joined in this platform, I know you all know lots of things about COVID-19 because when this disease started in the month of December, there were a lot of confusions. There were a lot many rumors, but since now a lot many things has already been cleared by our Ministry of Health, our Dental Council of India, WHO, ADA, and many other associations related to dentistry as well as medical health. But still, if you have certain doubts, we will definitely talk about this. So, all as you are all aware, this corona or COVID-19 started from China, and slowly it spread to all over the world except for Antarctica. Antarctica is the only continent in the world which is still not affected with COVID-19 disease, but rest of everywhere, more or less, this COVID has reached. But the best thing which I find about the COVID-19 is, although it is the same virus which has affected our world before in Saudi Arab, in Middle East, in China, but the mortality rate of COVID-19 is not as high as the previous COVID, this coronavirus infections. That is the reason WHO gave a different name to this infection, that was COVID-19, to decrease the apprehension of the people, because otherwise the mortality rate was 18 to 24%. But in this COVID, this coronavirus, which is infected now, the mortality rate varies from 1.2 to 2.4, which is almost 10% of what was before. This is the latest data from the WHO website, which I have just taken today afternoon, rather evening. That is how many people are confirmed cases and how many deaths have already been reported. And these are the deaths which have been reported to WHO. The number may be much more, but this is the number which has been reported to WHO. And you can see to the tune of 9.5 lakh deaths has already been reported, and roughly 30 million confirmed cases of COVID-19 have reported. And this is also the latest data which I have taken yesterday evening. And according to, you see that we are number 2 in the world now. And otherwise, uh, we we were way behind all other countries, but now the cases are increasing. So particularly, I think we in India needs to be more careful, and especially the dentist, we need to be careful because we work in the vicinity of infection. That is important. And there are different sources of transmission. The patients, obviously, who are symptomatic, they are a reason for transmission of infection. The patients who are infected but asymptomatic, and the patients who are in incubation period, neither they're having any symptoms nor their test is coming positive, but they can spread infection. So that means whenever a pandemic is declared, we have to consider each and every person we meet in life as a suspected case of COVID, and accordingly we have to uh, follow the instructions which are given by different authorities. And this COVID-19 virus, this coronavirus, doesn't spread through air. That is for sure. It doesn't spread through air. It spreads through the droplet. It spreads through the contact surfaces. So it's better, it's best to sanitize your all items very, very frequently. This is very, very important for all of us to know, because if you look at the car key, if I say, your mobile phones, if I say, because most of the times, every time we carry our mobile phones, so now it is always advisable not to share your things with someone else. That is important. So your car keys, your pen, because if you are working in a dental school, dental college, So don't share your things with your friends, your colleagues. Don't share your pens, don't share your pencils, don't share your mobile phones, don't share your car keys. If at all it needs to be, it has to be sanitized before you reuse. That is important. And one arm, I mean two arm, one arm from on each side distance is very, very important. Minimal 1 to 3 meter distance is advisable. And whenever you see a patient who is coughing, who is sneezing, who seems to be symptomatic, who seems to be having some respiratory symptoms, it's always better to keep at least a distance of 6 feet. That is very, very important. And all of us, our kids, our patients, all our friends, our family, we must know how to have a respiratory etiquettes as well as sneezing or cough etiquettes. This is very, very important because this virus spreads through droplet infections. That is confirmed now. The studies are confirmed. So something about this COVAX. I just wanted to share something about this. Till now, the coronavirus is not available. There are clinical trials which are going on, still not confirmed whether it is effective or no. But this COVAX is not the name of the corona vaccine. This is a name of the consortia. This is the name of an organization kind of thing which WHO has made, including many countries who can financially support this program. So the aim of this COVAX, this organization, is to have 2 billion doses at the end of 2021. Their main aim is to vaccinate 20% of the population of the countries. Not 100% of the population of the country, 20% of the population of the country has to be vaccinated. This is the goal which they have framed. Because if they are able to vaccinate the people who are high risk patients, high risk people like immunocompromised, old age patients, very young children, or the patients, the workers who are healthcare workers who are in close vicinity in the treatment of patients. So those has to be vaccinated first. That is the first goal of this COVAX. And another goal is, like, there are many countries who cannot financially support this program. So to give them a free vaccination, and especially the people who are residing in refugee camps, because they cannot financially support their vaccination program. So this is the main goal of this COVAX, to provide free vaccination to people who are underprivileged, who are staying in refugee camps. That's important. But till now, since there is no therapeutic strategy, there is no treatment for coronavirus, so prevention is the only aim of all of us. So how we can prevent of this transmission, or if we are not able to prevent the complete transmission, how we can reduce transmission in the community should be our main objective now. And that is what is government doing. And what, as a dentist, how we can help in transmission of this prevention of transmission of this infection is, we must access only the reliable information. Do not believe on WhatsApp, Facebook, or I'll say the newspapers. Only believe the government agencies who are related with providing health services. Like you have ICMR, we have WHO, we have Ministry of Health and Family websites. These should be, and Center for Disease Control. All these has to be followed. Avoid panics, avoid rumors, and only take recommendations from your local body, from your state body, from your government public health officials. Do not believe anyone else. And whenever you are advised to suspend your non-urgent care, we have to do it. So if the government permits you, you can start it. Now in India, there are hotspots are there. So accordingly, the government is guiding us when to start the practice, when to stop the practice, and accordingly, we have to follow those guidelines. Now, why we need to stop elective procedures, that is also important to know. Why we should not do all procedures freely. Because first of all, as a dentist, it becomes difficult for us to differentiate between true positive patients. Because the patients who are asymptomatic, the patients who are not having any symptoms, it becomes difficult to find out whether this patient is having some problem or no, because we don't have those test facility into our practice. We cannot ask the patient to go with uh, CT scan of the chest, right? Because that is what a medical person can recommend. So it's always better to stop elective procedures whenever your area is infected with COVID patients. But you have to look at the government regulations, government instructions for that. And another thing is, whenever you are doing a patient, you need a personal protective equipment. That is also very, very important. And till now, already it is in shortage is still going on. So it's better to utilize uh, these PPEs for really sick patients. And another important thing is, in dentistry, we have to do everything with your aerotas. So most of the procedures are aerosol procedures. Even if you use your three-way syringe, it also produces aerosols. If you are doing a simple scaling, it also produces aerosols. So it becomes difficult to manage a patient without production of aerosols. And if the patient is infected, you all will be prone to infection. So that is the reason, wherever emergency is not there, wherever urgency is not there, then it is better to avoid doing or delaying the treatment till the time the things become normal. So that is what we need to do. And another problem into our dental practice is, we do not have airborne infection isolation rooms or a negative pressure rooms. That is another problem. And secondly, we do not have a single patient room, especially like in a dental college. In dental college, in one department, all 23, 24 chairs will be in one room. So we do not have a single patient rooms. So there is always a chances of transmission of infection. And secondly, N95 masks normally are not stocked in dental clinics. That is another problem. And what kind of mask needs to be purchased, that we will discuss in the coming slides. These are the infection control protocols, infection prevention protocols, which we need to follow. I will discuss one by one all these protocols, which we need, how we need to follow. So whenever you need to do a patient, first of all, screening a patient is important. Previously, the instructions were that you need to screen the patient for any international travel. But in most of the countries, this guideline has been abolished, because everywhere the patients are there. This statement was true when there are foci of infection in certain countries. But now since all countries are infected, so it is not possible to have some relation with the international travel, because even in India now you can see lots of cases are there. But many countries now don't go ahead with this guideline. But in India, still we follow this guideline, that if we have an international travel, and then you have to delay or postpone your treatment. That is one. And you need to go ahead with the sign and symptoms of infection. That is also very, very important. Always take temperature of the patient by using non-contact thermometer. This is very, very important. I think nothing new everywhere now. It has become new normal now. You go to any store, any mall, any theater, any airport, everything, this is all taken care. Because we have a Arogya Setu app that is also checked. Temperature is also taken. And if there is a rise in temperature, they don't allow you to board the aircraft. And you must use a protective equipment, personal protective equipment in the form of your goggles, in the form of your N95, in the form of your PPE suit, in the form of your head cap, all these, and gloves, of course, according to the procedure which you are performing. We will discuss like how and in where we need to use what. Use of rubber dam is very, very important, because if you are using rubber dam, there will be hardly any infected aerosol, hardly any infected aerosol. That, so rubber dam, wherever it is possible, you must use rubber dam along with high vacuum evacuation. High speed evacuation is very, very important. High speed suction is very, very important to use in all your aerosol generating procedures. That is important. Autoclave your hand pieces, that is also very, very important. And we all must have non-retracting wall or into all your hand pieces. That is also important. Wherever your water line is, you should have a non-retractable wall, because what happens, previously, whatever handpiece we use, when you stop the handpiece, it suck back a little bit of fluid, and sometimes it suck back saliva also, right? So, and it will infect whole of your tubing. So now the guideline is, before and after use of handpiece, you must use for 20 seconds, so that your water line is clear of anything which is even sucked back. So 20-second before and 20-second after use of handpiece, you must start the handpiece so that the spray is, it comes out, and all whatever the infection has gone inside, it comes out. That is very, very important. And we must clean and disinfect all public areas, and four-handed technique for controlling infection. That is also very, very important, because if you are using a four-handed technique, once is you can complete the procedure quickly, and your assistant can do suction, the assistant can disinfect the area, all that things can be done. So four-handed technique for is very, very important. The patient, the another thing which is important for you as a dentist, as a professional, if you will be going to a dental school, like suppose you are a UG intern or a postgraduate, it is very, very important. Like, if we are having any underlying medical condition, we should avoid doing practice. We should avoid doing practice. Dentists who are above the age of 65 years and having any of these conditions which are mentioned, like diabetes, heart problem, lung, chronic lung disease, any cancer, patient is on immunocompromising drug therapy, those should avoid practice, and especially the aerosol generating procedures. That is important. And if we are suffering from any of the symptoms of respiratory infection, like we are having cough, sore throat is not the major symptom in COVID. Basically, it is the dry cough, it is the fever, it is the dyspnea. All these are the main symptoms of COVID. And the sore throat and GIT symptoms are not found in all the cases, but yes, these are also found in the cases. And even the rhinorrhea, the running nose, is not the major symptom of COVID-19. Like suppose a patient is, we have a common cold before, and then we get a little bit of sore throat. That doesn't mean we are having COVID. But still, if we have these kind of symptoms, we should not go to our practice. We should stay back home, and we should rather not even mix up with our family. That is very, very important. And the patient, these are the patient, this is the kind of patient which should be not given the treatment, like the patients who have traveled internationally, the patients who have been hospitalized in the last 28 days, because sometimes otherwise patient was not hospitalized for COVID, but because he was admitted there, maybe he got infection. And the individual who comes from the hotspot area must be tested first, and then they should get the treatment. And all healthcare workers, if they are dental patients and who are symptomatic, should not get the treatment. And the patients who have any symptom of respiratory depression or in respiratory infection or influenza should not be given the treatment, or any history of direct contact with COVID positive patient, if any patient gives you, then they should not be given the treatment. That is very, very important. Now, before you start any dental procedure, there are few things which are very, very important for all of you to know is you should not encourage the patient to come in groups. There has to be appointment-based practice. Walk-in patient should be avoided. But if a patient comes walk-in without informing you, then ask the patient to stay in their vehicle or outside till the time your operatory or waiting hall is clear, is safe to receive those patients. So if the child is there, definitely the child will come with the guardian. But if possible, if the adult patient is your patient, then ask the patient to come alone if possible. But if a very old patient is there, very young patient is there, definitely they will be accompanied by a guardian, but then it should be only one. They should not come with both parents, only either mother or father should.
मम्मी ये क्या रहा है
That is very, very
ये क्या है ये आज
Then call the patient.
माधुरी तो कांजी लगे
May I request Manisha Soni to
हाँ
may I request Manisha Soni to switch off the microphone, please? Manisha, can you switch off the microphone? Thank you. You must call the patient before you call the patient to your operatory. Give a call to the patient and preferably a video call. Preferably a video call so that you can talk to the patient directly and know about their symptoms. And if they have any symptoms, if they have any positive history with contact with those patients, then do not recall the patient. Do not call the patients. So like this, you can go ahead with the pre-video appointment. This she is my friend from Brazil. She is doing she is basically a pediatric dentist, and whenever she does this kind of video call, apart from knowing in detail about the patient related to the COVID symptoms, she gives instructions. If the patient is only manageable on phone, like suppose she come to know that this patient can be treated with medicine only, even it's best not to call that patient into your practice. Even it is recommended, like you have taken say impression for Holly's appliance, you know it's a removable appliance, and you can even post this appliance to the patient and ask and guide the patient on video call that how to wear it. So it is always better to restrict the entry of the patients, to restrict contact with the patient to minimum if it is possible. So on phone, you can advise the patient antibiotics, you can advise the patient's analgesics, and you can advise the patient to call you back after 48 hours to 72 hours if their symptoms do not resolve. And another thing is, you need to be in touch with your local pharmacy person, and you need to guide the patient, like you visit this pharmacy and I'm giving instruction to this pharmacy to give you the medicine. Otherwise, some pharmacies during COVID, they do not dispense medicines to the patient on just without prescription. And since you will be giving the instructions on phone or maybe on video call, and you may not be giving the prescription, but if it is possible, you can even mail the prescription to the patient. So when patient arrive, ask the patient to wait outside. The patient should not be like normally we fill the online form, I mean the physical form about history and all that. It's always better to you fill only the online form so that the contact with the patient is not there. That is important. And when the patient is sitting into your operatory, they should all wear at least a mask, and ask them to wash their hands with soap and water for 20 seconds. That is important. And if it's not available, at least sanitizer. And sanitizer should be taken, a coin size sanitizer on hand, and it should be rubbed all surfaces of the hand till the time it is dry. Dryness should not Priyanka, can you switch off your microphone, please? Then the sanitizer which they have applied on hand, that should not be let it dry with air only, but it should be rubbed till the time is dry. This is important. Normally what happens, we wet it and then we wait for it to dry, but it should not be. It should be rubbed till the time it becomes dry. That is the proper way of that. And then you can give the shoe cover to the patient to wear, and you can give tissue papers also, so that if they have their cough or sneeze, they should use those tissue papers. And then the pedal receptacles should be used, like the dustbin, which are operated by paddle, that should be kept into the waiting area. And we should avoid unnecessary contact with the patient. And now it is also advisable not to encourage the medical representatives to visit, the friends to visit, the relatives to visit to into your practice. It is always should be avoided. So you can ask your medical representative to give you a call, and maybe by email they can send you whatever the information they want to. Then the detailed history of the patient is taken. Then there is a consent form recommended for, especially for the COVID, that has to be filled by the patient. And there has to be distancing of 6 feet. You should place your chairs into your operatory, which are 6 feet away. And the chairs and the furniture should be cleanable, easily cleanable. So avoid keeping the furniture which is of clothes, which is made of clothes, like sofas, right? So it's always preferably it should be plastic, it should be metal, or it should be leather, which can be easily cleaned, which can be easily disinfected. That is important. Now, if you look at this picture, you can see child behavior management, in which a modeling is going on, and the dentist is allowing the child to play with the instrument. But these things are not possible now. These feels like dream, because I'm a pediatric dentist. I cannot do these kind of treatments now, because I don't want that my child, a patient who is watching the treatment going on, should get infection. So these are just a dream for me. We have different alternatives of behavior management technique, which we will discuss sometime later, whenever Anmol will give me another chance to be with all of you. So in evaluation of patient, you have taken the history of contact, you have taken the history of travel, and whosoever patient is even accompanying a child or parents, suppose the parents are there and one son is coming, they should also wear the mask, and you should take the temperature of them also. It is not that temperature reading of only patient is important. Temperature of anyone who is entering into your operatory is important. That is very, very important. So if you find a suspected case or confirmed case on taking a history, then you defer the treatment. Ask the patient not to get the treatment and isolate that patient. And wherever he was sitting, wherever he has moved, you have to clean, disinfect, and if possible, discard the surface supplies. That is it. At least 6 feet around that patient has to be kept clean. And now, after you have decided to go ahead with the treatment, important thing is you must ask the patient to rinse with hydrogen peroxide before beginning of any treatment. Either 0.2% iodine povidone solution or 1 to 1.5% hydrogen peroxide solution. That is very, very important. And try not to do the procedure which can induce cough. That is important. We used to it was recommended that instead of taking intraoral radiographs, CBCT, OPG, or extraoral radiograph should be taken, because when you insert the radiograph into the mouth of the patient, of the mouth child or patient, they gag and they may produce aerosols. So it was recommended not to. But since you are well protected, you are already covered, you are well protected, even if you go ahead with intraoral radiography, I think there should not be any problem. But the only thing is, there has to be a reasoning for it. But yes, if you can avoid, nothing like that. But otherwise, if you are well protected, if your face is protected, your eyes are protected, your mouth is protected, your nose is protected, even then you can go ahead with these intraoral radiographs. Now, sometimes we think, what is an emergency? What is a dental emergency? Dental emergency, there are guidelines about what makes a emergency in the dentistry. That is uncontrolled bleeding, wherever there is a cellulitis infection which is compromising with the airway of the patient, any trauma, any bone injury which is compromising patient's airway, that is actually a true dental emergency. But and then there are certain urgent dental care is also there. One is emergency, second is urgent dental care. There are few examples which comes under urgent dental care. One is severe dental pain, then pericornitis, and then dry socket, then tooth fracture, dental trauma in which the tooth has come out, the luxation has happened, and then dental treatment, like suppose the patient is having mobile tooth and he has to go under GA. And you know that if a mobile tooth is not taken out and patient is put under GA, then there are always chances of aspiration, or the tooth can go inside. So it's always better to remove that. And if you feel that the patient is not having healing of the ulcer, which is since say 14 days, and you need to see that patient, this is also one of the urgent care. Wherever biopsy is needed, that's also urgent care. And other than urgent cares are like removal, suture removal, then patients who are oncology patients who are on radiation and they had a denture and that denture is impinging and you want to repair that, you want to grind that denture, that is also important. And whenever old patient, you have a given denture to the patient is not able to bite because this is causing ulceration, that is also kind of urgent care. And these are a few of the examples. The patient is was having an orthodontic treatment and the wire came out and which is impinging onto the cheek and or the lip. The patient is not having able to bite or eat. So that is also kind of urgent care. But there are non-urgent, non-emergency dental procedures like a routine examination. Like sometimes patients believe that I should go to a dentist after every 6 months. So this is a routine examination. Do not call the patient for routine examination. Routine orthodontic treatment. It is just a normal orthodontic treatment. It is not a very emergency. Patient has some time. We can postpone this kind of treatment. The root stumps are there, which are asymptomatic, not causing any problem. The tooth which is badly decayed, not causing any problem, do not recall the patient for treatment. And any aesthetic procedure, that is also kind of a non-emergency. So in case of emergency, always use rubber dam, that is important. High vacuum suction is important. Face shield is important. Goggles are important, but goggles and face shield both are not required. So you can use face shield or goggles, but I prefer face shield because goggles sometimes does not give you 100% protection. So it's always better to use face shield. And if a patient has come to you for root canal treatment, and if possible, instead of opening the chamber with the handpiece, if we can use a chemomechanical removal system, and slowly you can remove the caries dentin and expose the pulp, and after exposing the pulp you place a devitalizing paste and seal, so that you don't need to remove the dentin or need to use a handpiece for access opening. So it's always better to use non-aerosol alternatives. That is important. And if at all you need to do aerosol generating procedure, always schedule that patient in as a last patient in the day, so that all patients that you have treated with non aerosol generating procedure, the last you do it, and after that you make your clinic disinfected. That's what is important. And preferably in an isolated and a well ventilated room, the treatment should be done, because into our practice we don't have negative pressure rooms. So it's not available. So at least it should be isolated room and well ventilated. Now it is recommended that you should not have a closed doors. We should have open doors, but AC you can keep on, no problem, because sometimes it's difficult to stay indoor without AC. But even when the AC is working, you should not keep your doors closed. That is important. And this is special recommendation in case of trauma. If any trauma happens and you have given a suture, it is, or you have done an extraction, preferably to give absorbable sutures so that patient doesn't need to come back for getting the sutures removed. As I have already discussed, that minimal contact with the patient should be there. And if you need to do irrigation, you need to rinse the wound very, very slowly so that you don't create a splatter. And sometimes a patient comes with trauma and you have to do emergency treatment. In that case, instead of waiting for RT-PCR test report, you go ahead with CT scan. In CT scan, if the changes, there are typical changes in case of COVID-19. So if you find these typical changes in CT scan into the lungs of the patient, then you have to manage the patient accordingly. This is another thing. And then the children, especially, or the patients who are having lung diseases, the patients who are immunocompromised, the patient who are having cardiac issues, the patients who are having renal failure, those patients should be avoided for the treatment. We should weigh the risk of benefit and the treatment. Those patients should be avoided. So sometimes you need child patients to put under GA. Not all the patients should be put under GA. Not all the children should be hospitalized in this pandemic, because we don't know who is moving into your hospital setup, and he may be a positive patient and the child may have infection from that particular patient. So they should be avoid to be hospitalized for GA. We can defer the treatment if possible. But yes, if you cannot postpone the treatment because of acute infection, because of severe pain which cannot be managed by giving a treatment under LA, there is a cellulitis where treatment is not possible with LA, or the patient is having such a dental disease which is affecting their medical health, and you need to go ahead the treatment with GA, then definitely you need to go ahead with GA. But you have to weigh. That is also very, very important. And whenever a trauma patient comes to you, it's always better to use bracket, ortho bracket, and wire to do the splinting. Because if you use composite and wire, what happens? You have to use a aerator to remove that composite. But if you are using bracket and wire, without using even aerator, you can debond the brackets from the tooth. So that is the reason. And it is always recommended preferred treatment now. First of all, we should postpone the treatment. But if at all patient needs endodontic treatment, so instead of endodontic treatment, it's a better to do extraction and give a space maintainer, so that you don't recall the patient again and again to, and especially the child patient. This is a true statement for primary teeth, not for permanent teeth. And this is another condition where there is a lot of caries, high caries is there, multiple decays are there. So schedule those patients in such a way that you finish the treatment in one sitting. You give IRM or glass ionomer in all the lesions, you fill it temporarily, and you put the patient for a follow-up. And later on, when the things improve, you can recall the patient. So now we should try to do maximum treatment in one day. Maximum treatment, whatever the treatment you can do on that patient, do it. So that should be the policy now, so that you don't recall the patient again and again. So if you want to do nitrous oxide, it is not contraindication. You can do nitrous oxide sedation even in this COVID infection. But only thing is, you should either use autoclavable or disposable nitrous tubings, because ultimately all the gases exchanges are going to happen in the tubing. So it's always recommended to use either disposable preferably, but otherwise if it is not available, at least autoclavable nitrous oxide sedation tubings are very, very important. So you can schedule your appointments as wet appointments, which are aerosol generating, and dry appointments, which are non-aerosol generating, so that you can call all your patients who do not need use of handpiece at one time, so that you have a minimal transmission of infection. And another important thing is the air exchange. And my recommendation for your operatory is you should have a fan, what you call a standing fan or a wall fan on your back, so that the air from you goes to the patient, and whatever the aerosols are there, those are pushed away. And on the left side of the patient, there has to be exhaust fan, then you yourself, then the patient, and the exhaust, or any good air filtration system that should be placed into your operatory. There are many procedures which are alternative to aerosol generating procedure, like atraumatic restorative technique, Fisher sealants, silver diamine fluorides, remobilizing agents, chemomechanical carriage removal systems, halting. I cannot go into detail of each. I'm sorry for that, because it itself is one full lecture for each of the technique, right? But yes, there are these techniques available which we can use as an alternative to aerosol generating techniques. Then we have details of personal protective equipment like gloves, then mask and the medical mask. In gloves, we have latex, we have nitrile. Choice is yours, but nitrile gloves are certainly better gloves, because these are powder free. And then surgical mask. Can surgical mask filter the coronavirus? Actually, the surgical mask is for the wearer. Suppose I'm a dentist, I'm using a surgical mask, I'm having some influenza, common cold, some infection. This will just confine my infection to myself. These surgical masks are not to protect me from others. These masks are to protect others from myself. That is very, very clear. You must understand this. So surgical mask, whatever 3-layer mask we use, does not protect us from others. It just protect others from us. Suppose I am having infection, my infection will not be transferred to the patient. But here, what we want to avoid is infection to a dentist from the patient. And that is only possible if we are using N95 or N100 face mask. And N95 and N100 is the American designation, and I mean American guidelines, and FFP2, FFP3 is the European standards for these kind of mask. So 3-layered mask, 2-layered mask, and N95, you must understand the difference between these all three. 2-layered doesn't give you much protection. 3-layer gives you protection. Give you means people are protected from infection what you have. But if you wear N95 or FFP2 at least, then as a health professional, you are protected from the patient. So the most common respirator is N95. We use, you must have seen people are using with valve, but actually valve is just to make the breathing easy. It has no role in filtration. So it is just an opening which has a flap. When you exhale, it opens and air is thrown out. So it doesn't give you protection as far as filtration is concerned. So if we are a dentist and if we have to use into our practice, we must use N95, which is without valve. So make sure that you buy a N95 which is without valve, not with valve. If sometimes we have a question that which is better, FFP2 or FFP3, N95 or N100. Actually, FFP2 is almost equal to N95. Only thing is filtration guideline conditions are better in case of N95. So I can say if a company is manufacturing N95, that will be little superior to the company which is manufacturing NFFP2, but not very, very significantly different. So three important things are very, very effective for any respiratory respirator to be effective. It should be correctly worn and removed out. That is important. You should know what is the correct way of putting in and what is the correct way of removing it. And then it should snugly fit it. Sometimes we complain that when I wear my eyeglasses get foggy when I wear N95. That means you are not wearing N95 properly. Because if you wear N95 properly, there will not be any fogging around it. That is for sure. And your respirator filter must capture 95. That is the guideline for N95. And then we must use respirator for longer time of use. That is also important, that you don't need to discard your respirators so frequently. You can use the respirators for long time. One is it's expensive. Second is the availability is a problem. And how we use it, I'll just detail you like how we can use these respirators for longer time. For better use, for better protection of N95, whenever you are using a handpiece over your N95, wear a surgical mask, because surgical mask or 3-layer mask is not very, very expensive. So if you wear a surgical mask over your N95, and even if the splatter is there, it will be protected. Your N95 mask will be saved. And after every patient, you can remove your surgical mask. You can change your surgical mask and keep wearing your N95 till the time it is visibly soiled. Because how we use it, I'll just tell you. And then we must use a cleanable face shield. That is also very, very important. Now, this is the guideline how we can have extended use of N95. This is the guideline. You should have 5 to 6 N95 for yourself. You mark it as Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. If you have a Sunday, so better you take 7. But otherwise, the inventor of this mask, which is Dr. Peter, he recommended that if you keep this respirator dry for 3 to 4 days, the coronavirus cannot survive on this mask. So even after 4 days, you can rotate the mask, but it becomes difficult to mark. So what I do is I mark my mask as Monday, Tuesday, Wednesday, Thursday, Friday, and Saturday. And I use one mask for each day, and rotation will be after 7 days. So when the next term comes, till that time, my mask is already environmentally disinfected, environmentally sterilized. So I don't need to use any chemical, anything. It will be by default, it will be sterilized. And never ever wash your mask, never ever disinfect your mask by using alcohol or something. It is not at all recommended. Now, important thing is 3-layered mask, surgical mask for all patients and visitors, 3-layered mask for all your front desk staff, N95 for the dentist and chairside assistant, and N95 mask for your clinic staff. These are the recommendations. We all must follow these recommendations. Because for cleaning staff, since the floor is infected, when they broom, when they clean, there will be a splatter. So we have to safeguard our cleaning staff. So that is why it is recommended for them also. But since your front desk staff is not coming in direct contact with patient, so it's better to give a 3-layered mask, because you know that N95 mask is not that easily available, right? So wearing mask when not indicated definitely result in unnecessarily cost, and it is a burden, procurement burden, especially during this period. You know, the gloves which used to cost 200 rupees per box is costing 650 rupees now, right? And these N95 mask was otherwise costing us only 26 rupees in the before pandemic, but it was available in 350 rupees. And now again, it has come down maybe to 100 rupees. But if possible, unnecessary use of a respirator as N95 should not be done. But wherever we are needing it, it should not be ignored. So judicious use of these has to be done. So this is one procedure. Many hospitals are using this procedure for sterilization of their N95 mask. So you can see in the picture there is a paper bag. So after UV sterilization of N95 mask, they are sent to the healthcare worker. So there is two bags. If you can see, there is a brown bag also. So this brown bag is for resending back for sterilization. So after use, they pack the mask into this brown paper bag and send it for sterilization. After sterilization is sent back, and all these masks are marked with their identity number so that there is no problem. And then we have these kind of face shields. One has a side protection, other doesn't have. So always use goggles if you don't prefer using a face shield. The goggles which have a side protection, so that there is no gap between the goggles and your face. And if there is a gap, these are not at all effective. And these are the face shields. This is Bhagyashri. She has designed beautiful face shields with different cartoon characters. So, but these face shields should always be worn whenever you are close to proximity of the patient, irrespective whether you use aerosol generating procedure or a non-aerosol generating procedure. You should use a good quality face shield, because see, this coronavirus can enter into your body from nose, mouth, and or eyes. Right now, how eyes? Because we know that there is a there is lacrimal duct which goes from eyes to your nose area. So if you touch your eyes, and if the virus gets into the eye, it can go to your nasal area, and from nasal area it will go to your respiratory area, because this virus has affinity for your respiratory mucosa. So face protection is very, very important, and that is only possible if you use a good quality mask, and as well as you keep your face protected with the help of a face shield, and you don't touch your face at all, not regularly even. You don't touch your face. So there are variety of gowns available. I think you all know well. Different gowns are available. Reusable gowns are the sterilizable gowns are also there, and disposable gowns are also available. So wherever you have a patient who is supposed to be a COVID positive patient or suspected patient, always use disposable ones. But otherwise, you can use even the autoclavable ones. And these are the chemicals for disinfection. For all of you, which is important for to know is the water line disinfection is very, very important. Normally, we don't mix anything in the water bottle which we have onto the dental chair, but there is a biofilm formation into all the water lines. That is the fact, that is evidence based, and those water line are the sources of bacterial infection to the patient. So always mix 1 ml of 5% sodium hypochlorite solution. All of our practice have hypochlorite solution in different concentrations. So, but this is the guideline that 1 ml of 5% hypochlorite to be mixed with 5 liter of water, and that water should be used for aerator and your air switch. That is important. And then for the surface which are non-metallic, the surface which are non-metallic, we can use hypochlorite 1% or 0.5% hydrogen peroxide, and the surface which are metallic, we need to have 70% alcohol. And there are many things available in the market. You can prepare your own 1% sodium hypochlorite solution. We have a liquid bleach. We have a liquid which is 5%. We have a sodium dichloro cyanoate powder is available. Then we have chloramine powder. We have a bleaching powder. I have given you the guideline how we can mix these things and make 1% of sodium hypochlorite solution. You can just take a screenshot of this so that you can make your own, and it is very, very economical. Then we have these kind of gadgets available in our market. These are there are different kind of evidences for it. Few are in favor, few are not in favor. Now it depends upon which product you are using, how effective it is. But yes, otherwise ultraviolet light is effective, but you have to be very, very careful when you use ultraviolet light into your practice, because you cannot use it for all kind of things. Then we have air purifiers. Important thing in air purifier is you must use a HEPA filter which is of 13 or 14 grains. If it is less than that, it is not at all effective. This one air purifier which I'm using is by Dyson. So this is a effective as far as company claims, and I think I have also experienced this is a good HEPA filter. So what I have done is I have placed on the left side of the patient. So on my right side there is a pedestal fan, the standing fan, and on my left side of the patient is the HEPA filter. So the airflow is from dentist to the patient and to the HEPA filter. This is how we do. And this is a picture of the negative pressure room. You can it's not possible in a normal setup to make it, but yes, the companies are there. You can search on Google who's make these rooms into the hospital setup. If you have nothing like that, but otherwise we can take precautions and do the treatment. And this is the air suction arm where it is placed near to the patient's mouth. Whatever the aerosols are generated, these are sucked by these suction arm, and then after filtration the clean air is thrown out. And this is another physical barrier, which are the plastic sneeze guards. So these kind of sneeze guards you can place on your front desk area, so that your front desk staff doesn't come in contact with the patient directly. And that's the reason you can give them the only the three layered surgical mask. And but if they have a closer proximity, then you have to give them also N95 mask. But these are the good things you all have seen everywhere. These sneeze guards are now new normals. These are placed everywhere. So if you are sick, do not come to your operatory. Make a policy. Whosoever is sick into yourself, your staff, don't allow them, or you don't go to the operatory. That has to be very, very judiciously followed. Guide your parents, guide your staff member not to use others tools and equipment. I have discussed that already discussed with you. They should not use these tools and equipment like phones and pens and all that staplers with others. They should have their own set of the things, right? And they should know how to use these PP kits. So few guidelines: dental procedure on asymptomatic patient, non-involving aerosol generating procedure, we can use this three-layered mask. But if you are using a face shield, if you are not using a face shield, you have to use N95, and then definitely PP kit and the gloves. That is important. And then in a aerosol generating procedures, no choice, you have to use N95. And the patients who are confirmed or suspected, whether you use do aerosol or non-aerosol, you have to use N95 along with your face shield, mask, and your overall or coverall or the gown. Important thing is you must take universal precautions from your waiting area. Remove all things which are unnecessary. No newspaper, no toys, no reading material, no mementos, no prize. Whatever we get from conference, nothing should be placed. Place things which can be easily cleaned, which can be easily disinfected. Clean all areas, common areas, including washroom or door handles, the railings, the toilet handles, everywhere. It should be cleaned very, very regularly. Don't let the patient walk in directly. Guide the patient to walk outside or into their car till you are ready to see them. Ask them to sanitize their hands, wear the mask, and take the temperature, symptoms, history of travel, and avoid unnecessary visits. Ask them not to come with so many people. You should have excellent telephonic triage into your operatory to handle those patients telephonically. That is important. And then if the patient is, if your staff members or yourself are not well, go for leave. Use rubber dam, high speed suction, oral rinse. This is very, very important. And clean, disinfect the areas within 6 feet whenever you find a patient who is a COVID positive, right? So history, if patient tells you that this could be a positive patient, always defer the treatment, take the patient in isolation and clean the area. That is important. As a normal person, what we need to remember, avoid unnecessary touching the people, avoid going into crowd, unnecessary travel should be avoided. Do not touch the lift buttons, the public buttons, or even the railings. Like suppose you are going up the stairs, do not touch anything. Keep something like a pen or something to push the buttons. That is important. And whenever you are in public, keep your face and eyes well protected. That is important. Do not believe the few fake news. Do not believe your social media. Try to stick to the trustworthy sources and do not check the updates very, very frequently, because unnecessarily it is scary when you cannot do anything. Like suppose there is a pandemic in certain area, there are a lot of cases in certain area, you cannot do anything. You cannot do anything. So then why unnecessarily worry about it? Try not to watch the news every day. Maybe once upon a time you can read the news. Do not uh, uh, watch the news every day. And if you share something on the social media about COVID, watch, read it first, and then you share it. First of all, try not to share anything unnecessary. It is a rumor. So don't share anything about the COVID or something. But if at all you share, just watch it, read it first, then only you share it. Because this anxiety, this corona is causing a lot of anxiety, especially into our professional, because and especially into our students, because the students and especially the postgraduate who have taken admission now, they are not able to attend their dental school properly. The patients are not available there. They're not getting good clinical knowledge. Although the online classes are going on everywhere, but in our dentistry, practical knowledge is important. So there is a fear of uncertainty, certainly. And as a practitioner, we are not doing the patients the way we used to do. So there is a fear of financial loss also, but nothing to worry. Medical and especially this dental profession is such a profession which has been least affected with any kind of recession. So nothing to worry. We are going to come up, and this is just a transient phase. This is a picture which I just saw on Google when I was doing some Google on some research. Like suppose tomorrow you get a news tomorrow on your TV screen that there is a X disease which is airborne, which is contagious, which is very, very deadly, and there are new cases of 20 lakh cases every year, and roughly 4.35 lakh deaths will happen. And see, 50 deaths every year. Will it be very scary for you? Yes, it will be very scary because it's more deadlier than corona. But believe me, this disease is already existing into our country, that is tuberculosis. This data is for tuberculosis. So already things are there, but since it is a pandemic, this is a new infection, and still this vaccine has not come up. I think prevention is the only thing which we can do. So if you are very anxious, when you are worried, uh, just focus on the things which you can control. Don't focus on the things which you cannot control. I've already told you that if there is a lot of cases in one area, can you do something? No, you cannot do anything. So then why to worry about that thing? But yes, you must plan for what you can do. That is important. And for yourself, it is important. Your health should be good. You should have a very good sleep, because whenever you have a good sleep, you eat healthy, you do good exercises, your immunity improves. And now what we need is good immunity. So our life are not over. Our sun is not set. Every day, whatever we have not done, because I remember when there was a complete lockdown, many a times me, my son, and my daughter used to go on the rooftop, and we used to watch the moon, and we used to watch sunset. So I think that was really beautiful, which I had never done in previous 40 years. I think I did many things now. Our love is not over. Our relations are not lost. We can talk to, we have the time now to talk to our friends, our families, wherever we have not talked, we should talk now. And learning is not stopped. I remember I have never attended so many lectures in my life, which I did in these 4 or 5 months. I have never lectured so much, which I did in these 4 and 5 months. I think the learning is a lot now. You can enjoy your music, whatever songs you have not heard before, because of your busyness. I think you can do that. No one is going cannot stop you from imagining the things. You can No one can stop you from your creativity. Like I have learned many things in cooking, because I had a lot of time, so I used to cook so many things, and my kids used to love that dad has cooked something for us. Your kindness is not over. And whenever you find something who is positive, someone who is infected, always try to help them, and that is very important. And hope is certainly not over. We are going to come up with this. Just immerse yourself in the beauty of life, and you must hug the beauty of life. That is important. So you have to be very, very strong, because we all know that these rains never remain forever. The storm doesn't remain every day. So together we can never stop. Do your best. Today you are someone's hope, and one day someone's hero. So if you have any question, I'm available on Facebook, on Insta, on phone, this WhatsApp, and this is my email ID. If you have any question, you are most welcome anytime to be in touch with me. Share anything, ask me any question. I would love to answer all your queries. So stay informed, well informed, stay healthy, stay safe, and enjoy your family. That is important. Yes, Anmol, do we have any question? Let me see. Uh, Hello, Anmol, are you there?
Yes, sir. Priyanka, take up the questions, please.
Yes, yes. Good evening, sir. Thank you
Good
for
evening, Priyanka. Good evening.
thank you, sir, for delivering me such a nice lecture, which related to COVID-19, and we all need this because we are going to practice our theory. I would like to.
Priyanka, I cannot hear you properly. Maybe this problem is with me, or Anmol, is it with you also?
No, it's with all of us.
What to do then? Should I check?
Anu ma'am, you can start.
Sir, that was an amazing session. Thank you so much for enlightening us. And it was
Okay.
very well elaborated. I think the entire fraternity will be like very it will be a very great help for the entire fraternity with this session. We have a lot of questions with us. Sir, Shoaib wanted to ask you that for the diagnosis of COVID-19, can we do it through the chest X-ray of the patient?
Oh, no, not the chest X-ray. Actually, chest X-ray may not give you the right finding, although it will tell you about the changes which have happened. But otherwise, only CT scan of chest is important. Because CT scan, if you go ahead with the CT scan, there is a typical picture of COVID patients as far as the CT image is concerned. And even if you don't go ahead with RT-PCR text, only with the help of CT scan test, you can come to know this patient is having COVID positive or not.
Thank you, sir. Sir, Aisha is asking regarding the vertical transmission of COVID. Like, if is there is a possibility, or is there any literature regarding if mother is negative but the child is found to be positive?
Yes, I have come across two patients as far as the literature is concerned, in which the mother was infected, but she was giving feed every day to the child, but infant was not having any problem. But in other, the mother was absolutely negative, but infant was positive. But that patient was born in a hospital setup, right? So it was possible that because since that infant was in the care of the caretakers, like the healthcare workers, so maybe he got infection from them. But yes, there are two cases which I have read in literature. One I personally know about, the first example I gave you. The second one was there in literature. Yes, definitely.
So initially there was a lot of debate and discussion going on on various platforms regarding prophylactic medication for the healthcare workers. So, and even we are back to our practice, but we have not taken any medication. So,
Yes.
what are your take on this?
Okay. Actually, as per recommendations of ICMR,
Yes, sir.
the medicine was hydroxychloroquine was recommended, and it is still recommended. They have not denied the use of SCQ for the health workers as prophylaxis, but many of the countries and have are not promoting or not recommending SCQ to be used because it has own side effects. But now what many countries are recommending are the vaccine against flu. They're recommending that we should give a vaccine against flu to all healthcare workers, and it has been found that if they are vaccinated with the flu vaccine, then they don't get very severe symptoms. That is what is recommended. But I was checking with the Indian guidelines. I could not find, maybe I missed it, but I know these guidelines are by CDC, USA.
So there's another question by Syed. Pneumothorax is shown by many smokers who wear N95 mask. In that condition, should they continue wearing N95, or like if the person is a smoker and is developing other complications? So
See, N95 mask wearing is recommended only in a limited segment of people. That is, whenever we are in contact with a suspected or an infected COVID positive patient, whenever we are a healthcare worker who are in close proximity to those patients. All healthcare workers are not even recommended to wear N95 mask, right? Even like I have gave you example that even our front desk people, although they are into the same room, into the front desk area, in the waiting hall area, but since they are not in close proximity to the patient, they are not supposed to wear it. They can just wear a surgical mask and the things are fine. But the dentist and the chairside assistants sit because they are in very close proximity, so that's why they need to. So any person who is a smoker, unnecessarily why he should wear a N95 mask when he is not into close proximity with the people.
yes. So there's another question by Jebun. The person is asking, what are the merits and demerits of mask with valve?
Oh yes, I think you're talking about Dr. Jebun Nisa.
Yes, sir. Yes, sir.
She is from Bangladesh, and she is the president of Pediatric Dental Association. And it's a very valid question. Actually, what else you want to know? Is it this message or something more?
So it's just this question. What are the merits and demerits of mask with valve?
No problem. Actually, I have already detailed in my lecture about the valve, because these are basically a particle filtration mask, which are for industry, not for healthcare system. The mask with the valve are used in the industry where is a dust, where are certain chemicals, but wherever infection is, these this mask with valve should not be used, because these are just to facilitate breathing. Because when you exhale, these walls open, there is a hole actually, right? So there is just a flap which is opening and which is closing with your inhaling and exhaling. So this is just for facilitation of your breathing, but it doesn't help you in prevention of infection. So we should not use mask, N95 mask with valve if we are into healthcare system.
Sir, I would like Anmol to conclude and talk to you.
Sir, I would like to thank you for giving us your valuable time this evening. Sir, it was an amazingly informative lecture. I would rather say it was a positive lecture in this need of an hour. In this pandemic, we are living with this pandemic and we are back with our practices. And this information and the safety precautions you have shared today with all the practitioners present here is really will help them in their practicing safely, I could say, much more safer, and they can deliver much more safer treatment also to the patients. So it's very positive and safe, we can say, lecture for all the practitioners, and we have learned many more things today. And I would thank Dr. Anu and Priyanka for hosting this session, and also my team Cynodent for making this event possible. And sir, again, thanks to you for joining us.
Thank you, sir.
Please, you all take care of you well and stay safe, and just let me know if I could do anything for you guys. It was wonderful.
Means a lot, sir.
Thank you, sir.
Thank you. Please take care of you well.
Thank you, sir.
Bye. Good night. Good night, all
Bye.
friends.
Night, sir.
Thank you so much for attending my webinar. Thank you. Thank you. Bye-bye.
Thank you, sir.